Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can also connect with me on other social media platforms. Please enjoy this sports medicine video. The topic of today's Dr. Ozello Sports Medicine Report is cubital tunnel syndrome. Cubital tunnel syndrome is also known as ulnar neuropathy of the elbow, sometimes abbreviated to UNE. The name is sort of self-explanatory. The cubital tunnel is right here. The ulnar nerve passes through the cubital tunnel. It is a compression of the ulnar nerve at the elbow, causing symptoms in the medial part of the forearm, the medial wrist, into the hand, the pinky, and the medial part of the ring finger. This is an extremely common condition in sports and in all walks of life. Cubital tunnel syndrome is the second most common nerve entrapment condition in sports. It's common among cyclists, mountain bikers, weightlifters, baseball players, football players, wrestlers, any athletes that grip, any athletes that spend a lot of time with the elbows bent or will be gripping, squeezing with the elbows bent, because there is a lot of traction on the ulnar nerve in that position. So cubital tunnel syndrome, this is a serious condition. You want to make sure when you start to feel symptoms, you take action immediately. The symptoms of cubital tunnel syndrome usually start to occur at nighttime. That's when you usually start to feel it. It may wake you up at night, or you may wake up in the morning feeling these symptoms. These symptoms consist of numbness, tingling, what we call paresthesia, which is burning and pain, also weakness. The ulnar nerve begins in the shoulder at the brachial plexus and travels all the way down the arm. It does several different things. It controls motor and sensory sensations. The sensory sensations, I already named the area, but when we talk about what's distal to the elbow, it is the medial part of the forearm, the medial wrist, the medial hand, the fifth finger, and the medial aspect of the ring finger, the anterior part and the posterior part. It also controls a muscle called the adductor pollicis. This muscle adducts the thumb, meaning that it allows the thumb to move closer to the hand and to the index finger. So this is the muscle, one of the muscles that it controls, that does this position right here with the thumb. This is called thumb adduction. It also does the finger adduction, where we talk about this finger right here for the ring finger. So if the impingement is at the ulnar nerve, there may be weakness and inability to hold the thumb next to the palm to perform thumb adduction and also perform ring finger adduction. There may be someone who cannot move their ring finger move the pinky towards the ring finger if there is an impingement on the ulnar nerve. So these are things that you want to recognize. These symptoms, like I stated, they usually begin at nighttime and will progressively get worse. If there is a long-standing case of cubital tunnel syndrome, there will be weakness in these muscles, and you could see it in your hand, or I can see it in a patient's hand, and they're going to have a difficult time moving. They're going to have weakness in the hand and lack of sensation in the hand. That's why it's extremely important. I know I've said this several times. It is extremely important to take action as soon as symptoms begin, or even before that, to help to prevent this type of injury. The ulnar nerve is very close to the surface right here, so many times it can take a direct impact. So one of the preventative measures you can use if you are in a contact sport, make sure you wear elbow pads, protect this area. You want to do everything you can to prevent this injury. Also, when the elbow is held in flexion, there is a great deal of stretch on the ulnar nerve. So try not to hold this position. If you're a cyclist or a mountain biker, shift your hand positions as frequently as you can to prevent yourself from holding the elbow in flexion or holding a position that places pressure on the ulnar nerve or on any area in the hand and the wrist. You want to constantly change your hand positioning so you're not holding that same position for an extended period of time. Contributing factors to cubital tunnel syndrome in sports are numerous. And I'm going to go over a few of those. Some of them I've already mentioned, like a direct trauma to the ulnar nerve, also holding a position for too long. Those are two common contributing factors, but there's also other ones that exist. There can be a strength imbalance. Many times athletes will do a great deal of exercises where the anterior or front part of the forearm and hand are getting very strong. And that can create a strength imbalance if there is not an equal amount of strength in the back, or I should say the correct balance or ratio of strength from anterior to posterior. Also, exercises where the elbow is held in flexion and the hand is gripped for a long time. This can place an abnormal amount of pressure on the ulnar nerve. Also, again, I mention this almost in every video, inadequate rest between training sessions. No matter what type of exercise that you're doing, you have to give your body an opportunity to recover between training sessions and recover between competitions. I always speak about overuse injuries and the three contributing factors. Obviously, too much training, inadequate rest between training sessions, and some type of biomechanical fault. So when we speak about cubital tunnel syndrome, too much training, poor technique, inadequate rest between training sessions, a direct trauma to the ulnar nerve, holding that position for too long, poor training technique, poor posture. These are all contributing factors that can cause cubital tunnel syndrome. So you want to be very cognizant of this. When you are training, use proper technique. Be in good posture. When you are on the bike, make sure that you're changing your hand positions. When you're running, do not squeeze a fist. I see people doing this all the time. They're squeezing and they're running, or they're holding their hand like this and they're running. Keep your hands relaxed as much as you possibly can. This will help you a great deal in preventing conditions not only cubital tunnel, but conditions in the hand, conditions in the forearm, in the elbow, in the upper arm, and even the neck. So you want to make sure that your hands are moving normally and that they are relaxed while you are running. Eliminate the contributing factors for this condition. Anytime there is a neuropathy or a nerve impingement condition in one area, that same nerve can be impinged or entrapped in another area. This is what is known as the double crush or the multiple crush phenomenon. For example, if there is compression of the ulnar nerve at the elbow, there can be impingement of the nerve roots that the ulnar nerve forms from up in the lower part of the cervical spine. There can also be impingement here at the brachial plexus, the network of nerves where the ulnar nerve forms from. There can also be impingement in the wrist and in the hand. So this phenomenon, like I said, it's called the double crush or the multiple crush phenomenon. Also, there can be, once there's impingement on the nerve, scar tissue can start to form and it can encase the nerve onto the muscles. So there can be multiple areas of nerve compression or nerve entrapment. So this is extremely important to know, and this is another reason why I stated earlier that impingement on a nerve can lead to a cascade of symptoms, and also why as soon as you start to feel these symptoms, you need to take action immediately. Professional care is recommended so you get the proper diagnosis. Do not try to self-diagnose yourself. Please never do that. Make sure that you have a proper diagnosis. The doctor will do a history. He will do an examination. You may need to get some testing done, maybe x-rays, maybe MRI, the type of imaging, possibly a nerve conduction velocity testing. So these tests will help to confirm the diagnosis of cubital tunnel syndrome and help you in the right direction for your recovery. As a doctor of chiropractic, cubital tunnel syndrome is a condition that I see in my office frequently. Like I said, it's the second most common nerve entrapment condition in all walks of life and in sports. So what I do as a doctor of chiropractic is I would check everything along the entire course of the nerve. And that's what a doctor of chiropractic does. Nerve impingement conditions are something that I see in my office all the time. So I would check the cervical spine, especially the lower aspect, the upper aspect of the thoracic spine. I would check the shoulder, the elbow, the wrist, and the hand. And then you can start with your rehabilitation. Your self-treatment is going to be extremely important because you want to eliminate the contributing factors. First of all, you're going to need to change your training routine. You're going to need to eliminate the positions and the exercises, or at least modify those positions and those exercises so there is less or zero impingement or traction on the ulnar nerve. This is the most important step in your self-treatment. You have to modify what you are doing. Also, one thing that I didn't mention is ergonomics. A lot of times when we are typing, when we're sitting in a chair, we may be putting pressure on the ulnar nerve if our armrests are not very soft. So you want to make sure that you have soft armrests on your chair, because if you're constantly placing your elbows on the armrest and putting pressure on a nerve, that can lead to cubital tunnel syndrome. So we have to think about our ergonomics. When we're training, when we're working, when we're sleeping, we have to be mindful of our body positioning. When you are driving, you do not want to have your elbows bent, holding the steering wheel way up here. Try to use your hand position of 3 and 9 or even lower. That's going to prevent you from shrugging your shoulders. That's going to prevent you from actually just holding the steering wheel too tight. So try to hold it in a relaxed position when you're at least at 3 and 9 instead of 10 and 2 or even higher than that. So use the 3 and 9 position. Also, when you are driving, do not grip the steering wheel tight. Try to hold it as loosely as you can. When you're sleeping, try to fall asleep and be in a position where the elbows are not flexed all the way. If you can keep your arms straight or fairly straight, that is the best position. Also, try not to have your arms up over shoulder height. That can cause impingement in the neck and also in the shoulder. So you want to have good body position. When you are training, keep your neck in line with your spine and keep your spine straight. Always use good technique, always use good posture. Try to eliminate any type of exercise where you are constantly flexing the wrist or where you are squeezing the wrist, where you are constantly flexing the elbows. Now you can obviously do those exercises, but you want to modify it, and you want to modify how you have your wrist positioned. And then try not to hold a flexed wrist or a grip position with the elbow flexed. When you are doing, for example, bicep curls, if you're using a dumbbell, keep your head straight. Do not do this. This is a technique that I've seen people do, and you want to make sure that you are looking straight ahead and bringing the dumbbell up. So the neck stays in a good position and the shoulders stay in a good position. That is just one example of proper technique that you want to be very mindful of while you are training. Another thing that you can do is just massage the muscles. Don't press down on a nerve. Do not press on that nerve. One thing that I didn't say, I figured it was obvious, but I do want to say it. When you speak about hitting the ulnar nerve, that's when we say, oh, we hit my funny bone. I hit my funny bone. It's not a bone. You're hitting a nerve because the nerve is very superficial to the surface. So you want to be mindful of this. That's why I said if you play a contact sport, wear elbow pads. You don't want to come crashing down on this nerve. So the funny bone is the ulnar nerve. I'm not sure where that nickname came from, because it's not funny when you hit the ulnar nerve. But you always want to be mindful of your body positioning, and you can massage these muscles. Again, do not press down on the nerve, but the muscles around it. Real light. You can use your thumb, you can use the palm from the other side, and just massage those muscles. These are just some simple tools that'll help you out. If you start to feel symptoms, I know I've said this over and over again, take action immediately. Get to a doctor of chiropractic, get to another type of medical professional so you get the correct diagnosis, so it'll set you on your path to recovery. Thank you everyone for viewing today's episode of Dr. Ozello's Sports Medicine Report on cubital tunnel syndrome. Please feel free to like this video. Please, if you have suggestions, feedback, or questions, leave them in the comments section below. And if they're questions, I will get back to you as quickly as I can. Please subscribe to my YouTube page. Dr. Ozello's Sports Medicine Report is published every Thursday. My other show is 2 Minutes of Anatomy. That is published every Monday and every Friday. I give a quick 2-minute anatomy lesson. Again, my name is Donald Ozello. I'm a doctor of chiropractic. My office, Championship Chiropractic, is located in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Always remember, train hard, train smart, stay injury-free, and accomplish your goals.